Are you snoring? It's not your nose. One of the biggest myths out there is that snoring happens because your nose is blocked or it's crooked or it's too congested. Guess what? Your nose is a pretty rigid structure. It doesn't change whether you're awake or asleep. So if you're not snoring when you're awake, which none of us do, then there should be no reason you would snore when you're asleep because of your nose. But what is actually happening when you snore is the back of your throat changes. When you're awake, that back of the throat is kept open with muscle activity that is stretching that airway and keeping it open. But as soon as you drift to sleep, these muscles relax and the airway starts to constrict and the airflow becomes turbulent and noisy. So before you reach for that nasal spray or maybe even consider nasal surgery, rushing to the ear, nose, and throat doctor, realize that it is not your nose. What is actually happening is behind the scenes, behind the tongue. So let's give credit where it's due. And it may be if you're snoring, it's time to look for other solutions that target the real problem.